Hi guys. So in this part 2, let us understand about how to manage GDM and the long-term management about how a woman has to follow if she has developed GDM during pregnancy. So if there is GDM during pregnancy, how will I manage it? This is the question which is asked. So a woman will need more frequent prenatal visits to monitor the health for her health and also for the baby's health. There is the need to keep a track of the blood sugar, and the blood sugar has to be kept under control. So we asked that the sugar has to be done at least 3 or 4 times in a day, and the levels have to be under control. For most of the women, a healthy diet and regular exercise, so upper body exercises can be done. A regular walk of 30 to 40 minutes per day is important, and that can help control the sugars. For some women, some tablets have to be started, some medicines are needed, and some women also may need insulin injection. So we take also an opinion from a diabetology specialist or an endocrinologist who will help us monitor the sugar levels. How do you monitor the sugar levels at home? So a glucometer, which is measuring the capillary blood glucose, that is the blood glucose. A small drop of blood can be taken, and that has to be checked. And every time you are visiting your doctor, you need to keep a record of the blood sugar. Usually we can store it, either you can write it down in a notebook, on a paper, or there are phone apps, or you can email it to your healthcare professional. And that blood sugar recording will help your ob-gyn, will help your endocrinologist, will help the person who is monitoring your sugars decide what is the best care to be given. Usually we check the sugar, say morning around 6 o'clock fasting, then they check at 12 in the afternoon, check 6 in the evening, and even 10 in the night. So we have an idea how the sugars are throughout the day. The diet plan, how is the diet plan changing when there is GDM? So now is a time when making healthy food choices is very important, because you have to keep your sugar from becoming too high. If you have GDM and otherwise also in pregnancy, you should eat regular meals throughout the day. You can in fact have small snacks in between, like 6 times you can eat 3 meals and 3 snacks, especially at night. So when you eat at frequent intervals, say you are eating 3 meals every 2 to 3 hours, and then you're having 2 or 3 snacks 2 to 3 hours, your sugar levels are going to remain constant, and your body's insulin will be constant, and that fluctuation will not happen. So that is going to help control your GDM. Healthy weight gain is important during pregnancy. Usually we recommend not more than 10 to 12 kgs of weight gain, but it now depends also on what is your pre-pregnancy weight. So if you have gained too much weight, or if you're gaining more than 2 kilograms in a month, then it may be difficult to keep your blood sugar levels under control. So it is very important that a team is taking care of you. So you should meet somebody for your diet plan. You should have a regular exercise program under supervision, and also you are meeting your ob-gyn, and you're also meeting the sugar specialist or the endocrinologist. So the exercise definitely is going to help keep the blood sugar levels in the normal range, and it all depends on where you are, what kind of exercise you can do. So 30 minutes of brisk walking, as much as comfortable, after you ask your healthcare provider, at least 5 days a week. That means in 1 week you should be able to do at least 150 minutes of exercise, and the best thing to do is some kind of walking. If you are doing any pregnancy yoga, then you can do it under supervision with someone who has experience on the prenatal and the antenatal yoga for the pregnant women. So this helps to better control of the sugar. Now we also get a lot of questions about medicines, and are these medicines which are given for the other diabetic people safe in pregnancy? So we do need to give medicines for some women if the diet and the exercise is not able to keep your sugars under control, sometimes we have to give insulin, that is recommended medication during pregnancy, that is an insulin injection. And don't worry, this will not cross the placenta, so it is not going to have any bad effect on the baby. Also, you are going to be taught, if you need insulin, how much insulin. So because insulin is an injection, you have to be taught how much insulin you're going to be given and how much insulin you're going to need. So that is very important that you take it under supervision, and how you're going to store the insulin is important. Sometimes you may also be given a oral tablet for the control of the sugar. So it is not that always you will need insulin. Sometimes you will be given both insulin and a tablet. So that is the reason why we are monitoring your blood sugars at a regular interval, so that you are able to keep your sugars. Usually we want that the fasting sugars are between 90, something like that, and after food usually we say that after 1 hour it should not be more than 140 to 150, after 2 hours between 120 to 130. So basically throughout the day the sugars have to be kept under a normal range, and it is important that the fluctuation is not happening. What about health of the baby? So for you are doing the blood sugar testing and regular blood pressure monitoring also. For baby, you may need to do certain additional tests because like we say, sometimes the sugars which will cross the placenta, they can cause the baby's weight to increase. So we are going to monitor your baby's growth. That is done by a growth scan, right? And that is going to measure what is the baby size, how well the baby is growing, what is the level of the fluid which is around the baby, that is called the amniotic fluid. From your side, you just need to probably keep a count of what is called the fetal movement count. So that is a record of how you are going to feel as your baby is moving. So usually when the baby is well, the baby is going to move same way each day, and a mother is able to feel that movement from 5th or 6th month onwards. So if you have felt a change in the movement, or you feel for 2 or 3 hours there is no movement, you have to contact your doctor. Sometimes we do something called the non-stress test or the CTG test. So you maybe after you have completed your 9 months, there is something like a ECG recording for the baby's heartbeat. So that is done. You will be asked to go to the labor room, or in your clinic setting, if there is a CTG machine, you're going to be made to lie down, and this machine is strapped onto your tummy, and then you can hear your baby's heartbeat and a recording of that is taken. So that is something like an ECG, and your doctor is going to see whether that is fine. So it is a reassuring that NST or your CTG test is normal. Now the biggest question is the delivery. Is GDM, does it mean that you're going to have a cesarean? Does it mean you're going to have a normal delivery? So I think you should not worry. GDM or diabetes or any complication doesn't mean that you are definitely going to have a cesarean. Normal birth is always a possibility. So sometimes, of course, if you are having either GDM, gestational diabetes, which has developed during pregnancy, or a pre-existing diabetes, and you're also on insulin, you may be offered an induction of labor, which means 10 days or 2 weeks before your expected date, you would be admitted, and they will be giving you medicines to hasten or to start the labor pains for you. So that is called induction of labor. This is because we don't want to prolong your pregnancy more than that 38 weeks. Okay, and then depending on that, so that will depend on your condition, on how your sugar control is, and also whether you're on insulin and what are the other factors. So that is going to be decided with your obstetrician. Now, future, are there going to be problems in the future because of GDM? So if you have had gestational diabetes, there is definitely a risk of you developing again a diabetes in the next pregnancy or later on when you're not pregnant. So but definitely not everyone will develop, but the risk increases. So it would probably even be as high as 30 to 50%. Similarly, risk of blood pressure or any other heart disease, so all of this problem can happen in the next pregnancy, or it can also happen when you're not pregnant. So it's very important that this is the time you should do a lifestyle change, a lifestyle modification, and after your delivery and birth is over, after 2 weeks or after 6 weeks, that means 1.5 months later, you do a regular checkup and then you check your blood sugar levels. If it is a GDM, again sometimes a GTT is done, and if that is normal, you just have to remember 6 months or 1 year once you have to do a regular checkup. For children, women who have had GDM and it has not been controlled, sugars are high, the baby gets a lot of glucose, the baby grows with a lot of glucose inside, and that means the baby's insulin levels become high. So these babies can have a risk of diabetes future in their life. So it is important that as a baby is growing, your sugar levels, that is why we keep it under control. So the baby also, when the baby is born, the neonatologist, the doctors who take care of the baby, will be taking care of the sugars of the baby. Anything else that you have to do after pregnancy? Yes, you have to make sure that you bring about a lifestyle change, and you should do the regular sugar checkup after 6 weeks, and then again after 6 months, and then after 1 year. So it is important that you keep a tab on your health, and then every year you do the checkup. And once you maintain a good healthy lifestyle and you maintain a good diet, there should not be any problem.